Today, I want to talk about Mentor AI, which is a new piece of software that we've developed that I think is going to prove really transformative for our students. So let's get into it. So, Mentor AI is an expert system developed from the latest AI technology, trained on all of our documents, my book, courses, lectures, workbooks, everything we get our hands on. We're still in the process of training it, but it's a repository of all the coaching the body information that has proven so successful over the years. So we're really quite excited about it. Having knowledge is quite powerful if the knowledge is correct. So there's plenty of stuff out there on the internet. Google searches will yield all kinds of stuff about pain, and it's usually wrong. But to do this work properly, to do trigger point therapy, coaching the body work properly, you need to have command of quite a few things. So you have to know where muscles are. You have to have the fiber direction and so on, actions, function, attachments. Now, these are things you can look up, but looking up takes time. It adds to your load as a therapist to have to study before a session. Those of us that do it every day have a lot of these things at our fingertips, but a lot we don't when we still have to look things up and so on. And so trigger point knowledge, referral patterns, symptoms, differential diagnoses, all of our protocols, our treatment techniques, perpetuating factors, clinical tests. I mean, it's a lot. We know that if you have the correct knowledge and know how to apply these techniques, they really work. They're highly effective. Now, if you want to study about a pain condition, you have a new client, you want to learn something about their condition, you go to the web, you're going to find all the same recycled stuff that doesn't work. That's, in fact, why I created CTB in the first place. You have to have curated knowledge. So that's why we wanted to create Mentor AI. What you need is something that restricts the knowledge to something that you know has been vetted and you know really works. Now, if you look up shoulder pain, for example, if you do that on Google, you'll just find a laundry list of injuries. Tendonitis, clavicle injury, bursitis. It's like pick your injury. That's the only explanation that they really have. So clearly that is not what you want. Mentor AI has been trained on our materials, trigger point science, real clinical protocols, hundreds of courses, all of my writings, workbooks, lectures, and these are not the old ideas that have been proven to be wrong. So with Mentor AI, you can get accurate functional anatomy and trigger point details fast. You'll get in-depth CTB analysis. So we analyze things not just based on immediate referral, but also on satellite referral and networks of functional relationship between muscles. You can create treatment plans based on our protocols. You can explore which muscles might be responsible for a given type of pain, or go way deep on a given muscle about its anatomy, its attachments, its innervations, and then things like perpetuating factors, clinical assessments, all the information that we've accumulated over 20 plus years at this point. With Mentor AI, what you get is going to be accurate and useful. So this is a little test that I did, provide a detailed analysis from the CTB perspective on the causes of front of shoulder pain. And what you get is something really good. It's a detailed, useful, actionable answer. And it's the same material that we teach in our courses. So it points out that the infraspinatus is the most common muscle for front of shoulder pain. But then things like scapular dyskinesis, so improper scapular movement, which gets you involved with a whole other set of muscles. So in addition to the trigger point referral, it has all of our functional analysis that went into building our protocols. And this information is all there. It's all in Mentor AI. So I'm going to give you some examples of what it would be like to go deeper and to explore anterior shoulder pain. So first of all, we can find out what are the functional antagonists of the infraspinatus. Another question we can explore, what satellite referral patterns can influence the infraspinatus? So this is really important because just treating a single muscle, if you're not dealing with satellite referral, that muscle may be getting a constant barrage of referral from other muscles that keep it dysfunctional, and then your work is for naught. How is the infraspinatus inner? Now, innervation is extremely important as well because sometimes nerves, which in this case emerge from the neck, may be compromised at the spine or through the scalenes or other possibilities. So, if I'm interested in entrapment, I'm going to want to know about all the ways in which the suprascapular nerve, which innervates the infraspinatus, can be entrapped as it emerges from the spinal column. Now, if we want to go into CTB treatment, and what we would recommend as a treatment protocol, we can ask Mentor AI. So in this case, I asked it, what is the recommended CTB treatment for the serratus anterior? So we got a very credible treatment outline here, starting in side position, locating the inferior angle, going to supine position, using breathing, stretching, and movement, and then even resolving stretches, post-treatment considerations. Really a very thorough description of what we should do in a CTB treatment. Also, we have a client that's coming in with a case of tennis elbow. And you know some things about it, but it's covered in some of our more advanced courses and the CTB membership. I'd like to learn a little bit more. Don't do a Google search because all you're going to get is the same garbage. The usual injury explanation. It's going to be inflammation, injury to the joint, and all the recommendations are pretty much useless. So avoid or modify activities that aggravate it. So don't do anything, which does no good. This is a common response with trigger points from people that don't know about it because rest will temporarily calm a muscle down sometimes, not always. And usually it'll just immediately come back. Ice, which is the worst possible thing you can do because it reduces metabolism. What you need is more metabolism. So pain relievers, physical therapy, bracing. Not that physical therapy can't be helpful, but there's such an emphasis in a lot of physical therapy on strengthening and stretching, and you have to remove trigger points before you try to do those things. It's just mandatory. Otherwise, the tissues of the muscle are not adequate to the job. So this is pretty much worthless. Now, if we ask Mentor AI, we get a really detailed, informed response that goes deep into the causes from trigger points. And that's usually I have myself addressed many, many cases of tennis elbow pain. Early in my career, I worked on a journalist who had tennis elbow. She was just trying to kind of review my practice, and uh, we pretty much fixed her on the spot. So that turned out to be a really good thing. But you have to know what you're doing. The supinator muscle is the most common offender in tennis elbow. And then we have to understand what can set it up from, again, entrapments and satellite referral over that area. So the scalenes. So Mentor AI is implemented as a course in our Kajabi course library. And that's really nice because it'll be sitting there along with all of your other courses. You can open it up in a separate window or separate tab or on your phone or however you want to use it. So the training is very deep already. We're adding more every day. It does not drive answers from the general web. So that's really important to us. We had to find an AI engine that isn't going to go out and synthesize all of that injury garbage from the general internet. Works in all devices. We give you a full user guide. You can just basically leave it open whenever you have a question, even during a client session, which is really terrific. So how could we benefit from Mentor AI as a CTB therapist? Well, Doug and I honestly first developed this because we were interested in it for ourselves. You know, it's just really great to have a single portal that goes into all of our knowledge so that you don't have to remember which video was that in, where did that get written, or what chapter of 12 Simons, or whatever. Instant reference when you're studying, planning a session. You know, let's say you're studying some material, you just want to get more background on each muscle as you go along, it's right there. You can save the responses. It's something that you're going to really like. And it's something that is just going to be really useful. Client intakes. As you're reading through an intake, you want to understand the symptoms, diagnoses, how trigger points might contribute. Looking up the details of functional anatomy before, during, after a session. which will inform you as to the actions of the muscle, how to shorten it, how to lengthen it, how to do the techniques that we do to get rid of choke points. So accurate palpation, accurate understanding of muscle action, super, super important. Help in designing treatments. So what would a good CTB treatment plan be for this type of pain or this muscle? Understanding what perpetuating factors might be contributing to that person in their life. So, and setting up that condition. And you're going to come off as way more knowledgeable to your client, and you're going to have this stuff that nobody really has. I mean, the master level people, myself and Doug Ringwald and our high level teachers, we're pretty good because we use this information a lot, but I forget things. I mean, there's 32 muscles in the forearm and hand. If you're not doing that work every day, each of those muscles we treat, they're not all going to stick around in your memory. So you do have to sometimes look things up. And this is the best way to do it. Perpetuating factors, what corrections to suggest, what might be happening to set a problem up. And then even self-care information about muscles that you can give your clients. So super, super helpful. So pricing, Mentor AI, we're rolling this out at $19.95 a month, only for the first 100 people. So first 100 users will get price protection. We will be looking for feedback, and we're still refining the training and everything, but it's incredibly useful right now. So this is an amazing offer, I think, for what you get. I mean, this can really multiply your effectiveness and your knowledge and set you up as more of a go-to expert with your clients. You can look into it at ctbi.link/mentorai. And I really look forward to getting your feedback and seeing more people be super effective with CTB using our new intelligent assistant.